Somewhere on this planet, someone is having a stroke right now. By the time this video ends, thousands more will have joined them. And here's the part almost nobody explains clearly. In a huge number of cases, the brain sends out very specific warning signals hours or even days before the major event happens. You just have to know what they look like. Hello and welcome. Today we're talking about something that affects almost everyone, either directly or through someone they love. Stroke is the second leading cause of death worldwide, and it's the #1 reason people end up living with a permanent disability. Those are frightening numbers, but here's what I want you to take from this video instead of fear. Stroke is not lightning from a clear sky. In the vast majority of cases, it's the predictable endpoint of blood vessels that have been quietly degrading for years. And if something is predictable, it's at least partly preventable, sometimes even stoppable in the final days before it happens. That's what we're covering today. The 5 specific warning signs your body may already be giving you, why they happen, and exactly what to do if you recognize one of them in your own life. Before we get into this, let me know in the comments which country you're watching from and whether you or someone in your family has ever had a strange, brief symptom, numbness, dizziness, vision trouble that went away on its own and you never got it checked out. I read these and it helps me know what to cover next. Let's start with the 2 things people lump together under one word, stroke, that are actually very different events in the brain. The first is a hemorrhagic stroke. A blood vessel in the brain bursts. Blood pours into or around the brain tissue, and the pressure that builds up is often fatal. The second and far more common is an ischemic stroke. Here, a vessel doesn't tear, it gets blocked. Blood flow to part of the brain stops and brain cells in that zone begin dying within 4 to 6 minutes. Roughly 2 out of every 3 strokes are this type, which is why we're focusing on it today. To understand why every single minute matters, you need a feel for how demanding your brain actually is. It weighs about 1.4 kilograms, around 2% of your body weight. But it consumes roughly 20% of the oxygen you breathe and about 25% of the glucose circulating in your blood. It is a control center that never switches off, and it needs a constant fuel line. Cut that fuel even briefly and cells start dying in ways that cannot be reversed. That's why doctors describe stroke as a race against time, because it literally is one. Here's what most people miss. For a brain artery to suddenly block, the groundwork usually took years. The vessel wall gets damaged, cholesterol and small clots build up along it, the opening gets tighter and tighter. This isn't an explosion out of nowhere, it's the last step of a long, silent process. And along that road, your body usually sends out warning signals. The problem is, nobody ever taught most of us how to read them. In medicine, those early warning shots have a name, a transient ischemic attack, or TIA. Transient simply means temporary, it comes and it goes. Picture your carotid artery, the main vessel in your neck that carries blood up to your brain. Over years, a fatty plaque forms on the inner wall, usually right where the artery branches. The opening slowly narrows. At some point, that already tight vessel goes into a brief spasm. Blood flow drops for a few seconds or minutes, and the part of the brain fed by that artery essentially blacks out for that short window. You notice a symptom, then the spasm relaxes, blood flow returns, the symptom fades, and you assume you're fine. Here's the research that should change how you think about that moment. A transient ischemic attack very often comes right before a major ischemic stroke, typically within the next 72 hours. Those 3 days are your window, the stretch of time where the disaster can often still be prevented. Most people never use that window because the episode was short and strange, and then it simply went away and they talked themselves out of taking it seriously. These warning episodes usually last somewhere between 30 seconds and 10 minutes. That's exactly why they slip through the cracks. You're in the kitchen, in the shower, getting out of the car, and by the time you stop to think about it, the symptom is already gone. But each one of these moments is your brain sending you a very clear message: I am about to be in serious trouble. Let me walk you through what these 5 signs actually look like and what's happening inside your body each time. Number 1. Temporary blindness in one eye. You're walking toward the kitchen and suddenly one eye goes dark or foggy, like someone pulled a curtain down over it. You blink, maybe rub your eye, and within a minute your vision returns, so you blame it on standing up too fast. In reality, that curtain is almost always a tiny clot or fragment of plaque breaking loose from your carotid artery wall and briefly plugging the small artery that feeds the eye, a direct branch of the very same vessel that feeds your brain. When it lodges there, the retina loses its blood supply for a moment and you see darkness instead of a clear image. Doctors call this ameresis fugax, fleeting blindness, and it's treated like a fire alarm in medicine because that exact same clot could just as easily have drifted a few millimeters the other way into a brain artery instead of an eye artery. Number 2, sudden numbness or tingling on one side of the body. The medical term is paresthesia. Think of it as your skin acting drunk. An arm, a hand, half your face, one whole side of your body suddenly feels like pins and needles or like it's turned to rubber, and it happens out of nowhere while you're just sitting or walking. This is different from your arm falling asleep because you slept on it. That's simple nerve compression, and it clears the moment you move and blood flow normalizes. With a TIA, the problem isn't in the limb at all. It's in the area of the brain that maps sensation for that side of the body. And because each hemisphere of your brain controls the opposite side of your body, these symptoms are almost always one-sided. Numbness in both hands at once more often points to a neck or spine issue, not a vascular one. Number 3, sudden loss of coordination, the drunk walk without alcohol. You're on flat, familiar ground and your foot suddenly lands wrong. Your leg feels weak or rubbery, or a wave of intense spinning grabs you out of nowhere and you reach for the wall or a chair. The part of your brain responsible for balance and smooth movement is the cerebellum, tucked low at the back of your skull. It gets its blood supply from arteries running up through the neck bones, the vertebrobasilar system. If flow through those arteries drops sharply, even for seconds, the cerebellum essentially glitches and you veer, misstep, or feel sudden violent dizziness. The key difference from ordinary dizziness: benign dizziness almost always has a clear trigger, rolling over in bed, turning your head fast, a known inner ear issue. Dizziness that comes out of nowhere, especially paired with trouble walking straight, deserves to be treated as a possible TIA until it's checked out. Number 4, a sudden breakdown in speech. First, a reassurance. Forgetting your neighbor's name or blanking on the word toothbrush now and then is completely normal. That's fatigue or stress, not a stroke sign. What's more concerning is something much more dramatic. There are 2 main speech regions, usually on the left side of the brain. One helps you form words and send instructions to your tongue and lips. When it loses blood flow, you know exactly what you want to say, but the words come out slurred or stuck. The other helps you understand speech and organize your own sentences. When it's affected, you may speak fluently but say things that make no sense or fail to understand simple questions. If either of these shows up suddenly and then fades within minutes, that's classic for a TIA, not "I was just tired." Don't dismiss speech trouble just because it corrected itself. That's like your home alarm going off, stopping on its own and deciding it was probably nothing. Number 5, vitiligo combined with new, unusually intense headaches. This one surprises most people. Vitiligo, the patches of pale or white skin where pigment-producing cells stop working, is an autoimmune condition, meaning the immune system is attacking the body's own cells. When that process is active, it often doesn't stop at one organ. In many people, the same autoimmune activity can quietly inflame the endothelium, the microscopically thin lining coating the inside of every artery. A healthy endothelium is smooth, almost non-stick, nothing clings to it. A damaged, inflamed one becomes rough, and cholesterol, platelets, and inflammatory proteins start sticking to it, seeding future plaques and clots. Vitiligo alone doesn't guarantee a stroke, but vitiligo plus frequent, unusually intense headaches that don't fit your normal pattern is a combination worth a real vascular check rather than a wait-and-see approach. And a quick important note on headaches generally, a very common cause of frequent head pain has nothing to do with blood vessels at all. It's wear and tear in the small joints of the upper neck, sometimes alongside an undiagnosed disc problem. Headaches shouldn't just be numbed with pills long term. They deserve to be understood, especially when they change character or show up alongside any of the signs we just covered. Now, let's talk about what's really wrecking your blood vessels from the inside, because this is where one of the biggest myths lives. My cholesterol is normal, so I'm safe from stroke. Stroke risk isn't only about what's floating in your blood, it's very much about the condition of that endothelial lining. Think of it like a non-stick pan. While the coating is intact, nothing clings. Once it's scratched, everything starts sticking and burning. The first major enemy of that lining is chronically high blood sugar. Glucose needs insulin to get from your blood into your cells. When your body doesn't make enough insulin or your cells resist it, you can have plenty of sugar in your blood while the vessel lining cells are still starving. And starving cells get damaged, lose their shape, and can even peel away, leaving rough, scarred patches. Those patches lose their ability to flex with your blood pressure, and they become the perfect landing pad for LDL cholesterol, platelets, and other debris to build into plaque. This process starts years before anyone is officially told they have diabetes. Even mild prediabetes is enough to quietly injure the endothelium over time. The second major enemy is smoking. Cigarette smoke delivers thousands of chemicals directly to the inner surface of your vessels, causing chemical injury and inflammation, while nicotine and carbon monoxide make your blood thicker and stickier, increasing how easily platelets clump and clots form. Put a damaged, inflamed vessel wall together with thick, sticky blood, and you have ideal conditions for a clot to plug a brain artery. That combination is a large part of why smokers face roughly 2 to 4 times the ischemic stroke risk of non-smokers with similar cholesterol and blood pressure numbers. Blood pressure adds a twist that confuses a lot of people, and it runs in the opposite direction from what you'd expect. Chronically high blood pressure absolutely is one of the strongest risk factors for stroke. It physically stresses vessel walls over years, speeds up plaque formation, and is the main driver behind hemorrhagic strokes, where a vessel bursts. But an ischemic stroke often happens not at the peak of blood pressure, but at a relative low point. Picture a brain artery already narrowed by more than half from plaque, like a water pipe squeezed in the middle. As long as system pressure stays high enough, some flow still gets through. But if overall pressure drops, flow through that narrowed point can fall to almost nothing, especially if a small clot has formed right there. At night, blood pressure naturally dips by roughly 15 to 20%, completely normal physiology. But if you already have a narrowed artery, that nighttime dip can be enough to turn a partial blockage into a complete one, which is one reason some people go to bed feeling fine and wake up with stroke symptoms. Age plays a role too, but not in the simple "stroke is only for old people" way you hear at family dinners. Risk does rise meaningfully after about 50 and roughly doubles with each following decade, and in older adults the dominant causes tend to be plaque buildup, long-standing high blood pressure, and heart rhythm problems. But 10 to 15% of strokes happen in people under 45, and in that group the drivers look different: congenital vessel abnormalities, aneurysms, clotting disorders, autoimmune disease, and trauma to the head or neck. And here's a detail worth sitting with: after about 40, the same risk factors, smoking, high sugar, high blood pressure, tend to damage vessels roughly twice as fast as they did in your 30s. So ask yourself honestly right now, how old are you, and does that change how seriously you should be taking the numbers we've just covered? So let's say you recognize one of those 5 signs from your own life, even if it lasted under 10 minutes and felt small. You may have roughly 72 hours where a real difference can still be made. The goal isn't to panic, it's to not waste that window. A few concrete things worth planning ahead with your family and your doctor, especially if you live alone. Don't be completely by yourself after a suspected episode like this. If a more serious one happens and you suddenly can't speak or move, you need someone nearby who can see it, call for help, and get to you quickly. Tell a close person what happened and make sure someone can reach you easily over the next couple of days. Don't drive yourself. Losing vision or arm control for even a few seconds at highway speed is dangerous for you and everyone around you. It's worth talking to your doctor ahead of time about a transportation plan, so you're not tempted to drive yourself in if it happens. Check your blood pressure if you can. A top number around 180 or higher, or a bottom number around 110 or higher fits the picture of a hypertensive crisis rather than ordinary elevated pressure, and that alone is a strong reason to call emergency services. Ask your doctor in advance what threshold they want you watching for. Never start a blood thinner, aspirin, an anticoagulant, anything like that on your own based on advice from a friend or something you read online. Ischemic strokes and hemorrhagic strokes need opposite treatment. Thinning the blood can help in an ischemic event, but in a hemorrhagic one, it can make the bleeding worse and more dangerous faster. The only reliable way to tell the two apart is brain imaging, usually a CT scan in a hospital. No one can tell by looking at you. The right move is always to get evaluated and let a medical team decide. While you're waiting for help, body position matters. Lying flat tends to support blood flow to the brain better than sitting bolt upright. Many clinicians suggest a comfortable flat position with the legs slightly raised and the head kept neutral rather than sharply bent or tilted back. So neck vessels aren't kinked. It's also sensible to avoid smoking, alcohol, or very hot showers or baths in that moment, since sudden vessel dilation on top of unstable circulation can make things worse. Confirm all of this with your own doctor ahead of time. And keep a written list of the medications you take somewhere easy to find. It's a small thing that can save an emergency team precious minutes. Here's something important: if 72 hours pass and nothing else happens, that does not mean you're in the clear. It means you were given a second chance and you still need to use it. There are 3 evaluations worth asking your doctor about if you've had any of these warning signs. Carotid duplex ultrasound. This shows both the structure of your neck arteries and how blood is actually flowing through them, including turbulence at a narrowed point. If a carotid artery is narrowed by more than roughly 70%, that's called a hemodynamically significant stenosis, meaning blood flow is seriously impaired. At that point, the real question often isn't will a stroke happen, but when, if nothing changes, which is why surgeons may recommend a procedure to remove the plaque and open the vessel back up. HbA1c, or glycated hemoglobin. This measures how much sugar has attached itself to your hemoglobin over roughly the past 3 months, rather than giving you a single day snapshot the way a fasting glucose test does. It's especially good at catching pre-diabetes, the gray zone where sugar has already been high enough for long enough to be damaging vessels, but nobody's called it diabetes yet. Under about 5.7% is normal, 5.7 to 6.4% is pre-diabetes, and 6.5% or above typically fits diabetes. Holter monitoring, a 24-hour ECG recording rather than the brief snapshot you get in a clinic visit. Some dangerous heart rhythms come and go, sometimes for just seconds a day, and a short in-office ECG can miss them completely. The biggest one to catch is atrial fibrillation, where the heart's upper chambers quiver chaotically instead of beating in an organized rhythm, sometimes 300 to 400 times a minute. Blood doesn't empty smoothly from a fibrillating atrium. It swirls, and clots form easily in that swirl. Those clots can travel to the brain and cause a particularly severe type of stroke. Many people with atrial fibrillation feel almost nothing, maybe an occasional skip beat they blame on stress or caffeine. When it's found, well-studied blood thinners can reduce stroke risk in this condition substantially when properly prescribed and monitored. This is a risk you and a cardiologist can actively work on together, not something you simply have to accept. I want to be honest about the timeline here because I never want to promise something I can't back up. None of this reverses years of vessel damage overnight, but catching a narrowed carotid artery, pre-diabetes, or hidden atrial fibrillation early genuinely changes the odds, often substantially, and that's a realistic, meaningful win, not a small one. And one more thing that applies to everything in this video: if you ever notice sudden severe symptoms happening right now, not something from months ago, but active right now, that is not a wait until the video ends situation. That's an emergency room situation immediately. Let's bring this together. Stroke is not a lightning bolt from a clear sky. It's usually a predictable event that follows years of silent vessel damage, and it often announces itself in advance if you know what to look for. The 5 signs: brief blindness in one eye, sudden one-sided numbness or tingling, a sudden loss of coordination or a drunk walk, a sudden breakdown in speech, and vitiligo paired with new, unusually intense headaches. Any of these, even if it lasts under a minute, is worth an urgent conversation with a doctor and a request for those 3 evaluations: carotid duplex ultrasound, HbA1c, and Holter monitoring. On the prevention side, keeping blood sugar in a healthy range protects the vessel lining. Managing blood pressure with your doctor rather than chasing extremes reduces strain on your vessels. And quitting smoking can cut ischemic stroke risk by roughly 2 to 4 times over time. Above all, don't wait for a brief symptom to simply go away and assume it means nothing. You may have about 72 hours where real prevention is still possible. If you recognized any of these 5 signs from your own life, even from months ago, write them down in plain language and bring that list to your doctor. Don't rely on memory alone. Ask directly whether you should be evaluated for a transient ischemic attack and whether carotid ultrasound, HbA1c, or Holter monitoring makes sense for you. Everything in this video is meant to help you have a sharper, more specific conversation with your own doctor, not to replace one. I hope you found this helpful. Let me know in the comments your country and whether any of these 5 signs is something you're now going to ask your doctor about. If this helped you, subscribe for more and share it with someone else who might need to hear it. Next time, let's talk about the everyday habits that protect your blood vessels long before any of this ever becomes a concern. See you then.